Hi and welcome back. My name is Dr. Baptiste. I work as a GP, but I also have other careers as part of my portfolio career. These include working as a lecturer, writer, researcher, speaker and more. I have a keen interest in migraines, especially since I experienced my first aura as a medical student. I have treated patients with migraines for over a decade and continue to do so. I have also participated in research around migraines and delivered talks on this topic. If you do like this video, then please do give it a thumbs up and share it with someone who might benefit. Finally, before we start, I want to highlight that this video is not a substitute for sound medical advice, and if you experience any migraine symptoms or have any concerns, then please do seek medical assistance. You can do this by consulting your GP or family medicine physician or NHS 111 in the UK. In this video, we will look at what can trigger or bring on a migraine. But how do we define a trigger? A trigger is something either in the environment or within an individual that can essentially lower the threshold for a migraine attack in migraine sufferers. During the first half of the video, we will take a brief look at 4 studies that focus on some of these triggers. You might even be able to resonate with some of the triggers mentioned in the video. During the second half, we will look at important ways you can identify potential triggers and hopefully prevent a migraine or reduce how often they occur. The first study was a study conducted back in the 60s where 500 patients, 300 females and 200 males were interviewed. They found that menstruation, so periods, emotion, glare of light and certain foods were identified as triggers. Menstruation and emotion were the 2 commonest triggers. The second study is one of the largest studies about migraine triggers. Conducted back in 2007, researchers looked at triggers in 1,027 patients suffering from migraines. Similar to the first study, stress and hormones were found to be common triggers. And this was then followed by changes to eating, such as fasting, missing a meal, and even hunger. Others were weather changes, sleep disturbances, so oversleep and lack of sleep, smells, and alcohol. The next study evaluated migraine triggers in almost 6,000 females and just over 1,000 males. 11 triggers were analysed, including bright lights, stress, skipping a meal, sleep deprivation, high altitudes, and weather changes. They found that overall migraine triggers occurred more often in women, and multiple triggers were also more common in women than in men. The fourth study, which looked at the effect of smells on 200 migraine patients, an odor-triggered migraine occurred within 30 minutes of exposure in 70% of patients. Most common odors or smells causing a migraine were perfumes and paints. Other odors were gasoline and bleach. Importantly, the patients in this study were compared with 200 patients with tension-type headaches, and none of these patients experienced a headache trigger. There was also a tight correlation between osmophobia, so hypersensitivity to smells, and odorant-triggered migraine. So in summary, migraine-associated triggers are common and fall into 5 main categories: emotional stress, menstrual-induced, sleep disturbance, food and alcohol beverages, and weather changes. However, there are important considerations. Differences between individuals. Migraine triggers vary greatly between individuals, so what might trigger a migraine for you may not trigger a migraine for another person suffering from migraines. Some people may find, as we've seen from the studies we've looked at, that they may have multiple triggers, and a combination of certain triggers might make them more prone to suffering from a migraine episode. Lack of consistency. Triggers may not always bring about a migraine, and the same trigger may not always have the same effect. Now we'll look at some ways you can identify your triggers and how you can hopefully avoid them too. Identifying your triggers. So you may find it useful to keep a record of your migraines, for example, through a migraine diary. Identifying when they occur and what you were doing, for example, where you were, what smells you may have encountered, any stress at the time, or abnormal sleep or eating patterns might bring you closer to potential triggers. Stay connected with your GP or neurologist. Working with the clinician looking after you will help you explore potential triggers specific to you, and you can work on a tailored management plan together. Once you have identified some possible triggers, you can then focus on how you can avoid them. Now, of course, some of the things I will briefly mention may be difficult to do depending on your lifestyle. However, the examples are designed to provide you with just that, examples and ideas of what you could do in your own life day to day. Lifestyle factors. Try to be consistent with your sleep, trying to go to bed at the same time, practicing sleep hygiene, and not eating too late before you go to bed. Stay hydrated. Ensure you drink plenty of water, aiming to have sips throughout the day. Stress is all around us, so it is important to recognize how you can perhaps ride the waves or go with the current and not against it. Looking into mindfulness or meditation may help. Eating a balanced diet, including 5 portions of fruits and vegetables a day, taking vitamins such as vitamin D and B vitamins could help. I'll talk more about vitamins in another video. Think also about the studies that we've looked at, the environment, weather changes, certain odours. Finally, I would encourage you to continue speaking with your GP so that they are aware and can advise you of potential medications that could also help. I do talk about medications to provide headache relief in an earlier video. So that is a short overview of some migraine triggers. You may be able to relate to some of the triggers mentioned in the video. Please do comment down below and let me know what triggers your migraine and how do you try to avoid them. Please do like and share the video if you found value in it, as it may help someone else with their migraine too. I hope to see you in the next video.